like something you are really seeing it as a major player in terms of myopia while you are involved in all these school screening compared to earlier when you were used to do school screening? So, is it actually a big issue as we are seeing it to be? What is in your experience?
So thank you, Lakshmi. Alphabetically and most of the time, the sessions usually, most of them make me start because I talk a lot, and if there is time left, others could join. That's how it is. But please remind me if I'm like going above your time limit, I'll stop. Okay. So I missed you in between. So I was just thinking where I was just wondering whether you were asking the impact of myopia. And yes, as you, sorry?
Yes, Anuradha.
Okay.
Yes.
So
with time, how do you think it's changed with time, while you used to do earlier and now?
Yeah. So as you told, I've been taking care of the school children eye health programs for a significant, almost it's like more than a decade now, and it's been a very long journey. And I just want to take your question into like 5 different parts. Okay, the how it has changed over time, what was myopia before, and what has happened now. No, the first aspect would be the prevalence. Of course, the numbers are going to be very crucial. The differences in the prevalence. Okay, so the first component, like way back, in 2010 or 11 till 15 also. If we see the prevalence, I always used to say, I've told in many forums, there is always a difference between the schools that are present, between the public and the private schools, the schools that are present in the villages or that are present in the tribal location. And we have seen that the prevalence is less than 0.5% in the tribal areas. In the village, it is like almost 1 to 2%, whereas in the public schools, it used to be like 5%, and in the private schools, anywhere between 18 and 40%. But the recent trend, like especially after the home confinement following COVID, recently when we have started school screening this year, we find that the prevalence, we have only seen the public schools, that too the children who are above grade 9 and above. Even in that small group of children, what used to be only 5%, it's almost like 20% now, where the prevalence is very, very less, used to be very less. Now the prevalence is almost 4 times what it used to be before. So such is very huge change in the numbers. We are yet to see the numbers in the other class grades and also in the other types of schools. Slowly the schools are getting reopened. We are also going to see this pattern, but I'm sure this pattern is going to be almost the same. So what does that mean? The impact of myopia on the overall need in this country is going to be very, very huge. And it's all the more reason why we have to believe that school eye health program should be made very, very robust and then catering to all these children. The second aspect which I wanted to highlight, apart from the numbers, there is also another thing that I wanted to highlight, the magnitude of myopia. Okay, the magnitude, the spherical equivalent component, we used to see like anywhere in the grade 12, it used to be around minus 1.7 diopters. Now we are seeing it to almost minus 2.2 diopters, which is like a 0.5 diopter jump. In the same age group, the magnitude jump in the last 5 years, there is a huge increase in the trend. Just imagine, for every age, this is going to be a significant jump. And considering the progression definition, I feel this is a very, very significant point that we have to bear in mind. And the other thing that the third component is the gender-wise differences. We are finding that females are having more prevalence. Previously, the trend, it used to be there, but it is not so wide. But now we see the trend to be a huge difference between the male and female. Females having more. Probably they were so glued on to the screen, never went out. Maybe the boys had little sneaking time outside and all during the confinement. But the prevalence trend is huge difference between male and female. And again, not only in terms of numbers, previously when we used to visit the private schools for screening in the school children eye health programs, we found that though we say the private schools, the parents are educated, they, if the child complains, they go to, they take them to the hospital. almost 3% of the children never had an eye examination. We were the ones to offer a first time eye examination, even in the private schools. Okay. So I find that now with the almost 2 years of home confinement, and every parent that I am meeting, they are only talking about the academic miss out, the classes. They are not even bothered about the eye examination.
Correct,
so
yeah.
I am wondering how many we are going to be seeing new with refractive errors, especially myopia, when we go to these schools again. So these 4 components, and the last component is follow up, which is what I am really proud about, because that was my doctorate work. That was what I worked on for improving the compliance. It used to be only 18%, like 10 years back and all. If you see the compliance to spectacle wear, we could improve it to close to 58% around 2018. But when we were doing this REACH project, refractive error among children with the Orbis India, then we saw the annual complaints improved to 64% for spectacle complaints. But now, whomever I am talking with, they are saying we are only seeing the screen. We don't have any other need. So we have stopped using the spectacles altogether. So I'm very equally concerned about what is the impact of such changes in the lifestyle or the habits of children on the progression of myopia, because we say under correction or no correction, the impact of it on the magnitude or progression is yet to be understood. So I'm very much concerned. So this is what I see as a big change in the impact of myopia from what it was.
Definitely last 2 years, things have really changed. And it's interesting that you say the incidence of female is more, because in the recent IMARC, when I think Monica Jong from the IMI, she was presenting, she also presented the same, that incidence is female is more than male. But on the contrary, which I failed to understand, was axial length. When you see average axial length progression, they seem to be more in males than compared to females. So there is something happening, it is not 1 + 1 is equal to 2. It is not as simple as that, where you see incidence happening more in females than compared to males, which is, I'm happy that your data is almost close to, or in the same trend as the global data that is being seen. But when it comes to axial length progression, we are seeing something different. So I as I said, it's not as simple as just a refractive error, I feel. Myopia is not as simple as that. Coming to you, Joe, as Anuradha was saying, definitely government is doing some activity in terms of children eye health, and then organizations such as OCI or Elite School or other organizations, they all kind of play their part when it comes to children eye health and school eye screening. But Zeiss, I'm sure, is involved. We are also involved with you in a lot of screening activities. So overall, what do you think the corporate sector should play a role in terms of myopia awareness, and all of that? So what do you think is the need of the hour?
Yeah, thank you. I think the first responsibility of the corporate sector, the private sector, is investing in research and development. We need, first step is to better understand progressive myopia, collaborate here with science and academia and basic research, just to find better options to manage, control, and treat it. So really invest also in development of solutions, of products, specific eyeglass lenses and all the other things. And we are talking about Zeiss alone investing in total 800 to 900 million a year, and a significant part of that goes into ophthalmology and optical products. Second one is I'm really a believer that corporate has also to play a role in improving the quality eye care, healthcare, and healthcare for school children. We still see much too much unscreened children. We see too many schools without any kind of frequent quality eye care, especially in the rural areas, tribal areas, underprivileged children. I think this is just an obligation of companies, corporations, to join forces with organizations like the Optometry Council, with the renowned and very respected optometry councils and other initiatives. Just we really need to screen millions of children in India alone every year. Prevalence, this or that, we every time find so many children who just need eye care, be it for myopia simplex or progressive myopia. And the third one is that is also a very personal thing for me. Very often corporate or companies are just be seen as, give us some money, we do something with that. Give us some donations, some charity or that. I don't believe in that model. Just for a simple reason, resources from corporations are much wider than cash only. We have expertise. We have thousands of trained optometrists and opticians and scientists. We have equipment, we have technology, we have platforms like our brand new visual acuity online check. Little things that really can help to make a step change here. And I think bringing all together the expertise from organizations, from optometry colleges, or the motivated people like Anuradha, our Aloka Vision team, others. And then they, okay, you are great in education, you are great in mobilization and awareness. Maybe we are great in creating a supply chain to provide free classes to underprivileged children. And maybe you have some technology in the back office we can use. And altogether, I think really 1 + 1 makes more than 2. If everyone is contributing what he is best in.
Yeah, I think what you said, is very, very important. Like everybody pulls in what they are good at, and then
exactly.
we kind of co-manage the entire issue that we have in front of us. I think that's really very important in terms of what you're saying. Rizwana, she seems to be deep in thought. Rizwana. So talking about child eye health, it's not only, as I said, myopia doesn't seem to be so simple as we look at it. It's not just a refractive error. There are so many things that we discuss when you look at myopia and myopia progression in terms of lack of accommodation. And now I'm hearing that, well, lack of accommodation may not play a role in myopia progression. That seems to be one angle. So when we do such large, school screenings or, a massive effort where we are trying to actually on the ground increase awareness and speak about the importance of going for an eye exam, like what Anuradha is saying. What do you think, you feel in terms of diagnosing binocular vision anomalies, or what are the key things that you feel as a binocular vision specialist that, these are things that we should not miss? And what's the most common that you come across in terms of binocular vision and myopia, that relationship?
Thank you, Lakshmi ma'am. I mean, so first I will give you a quick perspective about the work that I have done so far. So for the past decade, I was closely working on evaluating the binocular vision, especially among school children. And also in the last 5 years, I have worked with, the myopia clinic team at Shankar Nethralaya, especially in evaluating the myopia prevalence, incidence, and progression among the semi-urban and the urban cohort of school children. So based on these experiences over this last decade, what I have to say is this. I mean, there's no one straightforward answer to as such, like in myopia, like what is this one risk factor, be it binocular vision or indoor or outdoor. And this changing landscape, there is like the constant changing dynamics of the near visual behavior, especially given this current COVID-19 pandemic, We wrote 2 letters to editor, one talking about especially what needs to be assessed in myopia, just beyond looking for refraction, the Indian Journal of Ophthalmology. The second piece was all about looking at individualized progression patterns, because though there are these myopia projection algorithms that says that 50% of the world's population will be myopic, and even the Indian predictions by Pavan et al. Also sort of aligned with that. But all these came before COVID, and now post-COVID, now that we are looking at these growth charts and patterns that are a little bit accelerated, especially the population-based studies that are coming out recently talking about the increased acceleration. Maybe these predictions also need to be relooked, but in a holistic perspective. So first, when it comes to binocular vision, I think it's totally related to the near visual behavior of a child. So the near visual behavior patterns have changed, and even in terms of assessing binocular vision, I'm rethinking all these paradigm shifts that we may have to adopt. But the 2 things that are constantly standing out, one is, of course, lack of accommodation is already enough debated about, but the results are equivocal. I mean, there is no one, the cat is not still out. So, but when it comes to the near ESO, especially the phoria status of a child, it is based on the clinical experience that I've had, and also when we look at some of the data that we have, near ESO, yes, it is one of the risk factor. I wouldn't call it a cause, but a strong association especially. And given that there are a lot of accommodative anomalies, like spasms of accommodation that we are seeing among younger age groups post-COVID-19 pandemic. And then, so if you see a child for the very first time being diagnosed with myopia, for example, let's say the school eye health programs that we do, we are seeing all of a sudden like a 10-year-old with -2.5 to 2.5, then I think it should trigger the thought process, oh, am I really dealing with true myopia here, or is there a component of pseudomyopia or spasms of accommodation? Second thing I said is, so then look at the phoria status, which could give you an indication if there are accommodative anomalies associated with or going along with myopia. The second is the instruments that we need, that we are using to assess the myopia in itself, like, the STEM project, the Shankar Netralaya Tamil Nadu SLR myopia study, where we looked at validating the open field autorefractor, because cycloplegic refraction by far has been considered as a gold standard in terms of estimating myopia, at least as at the baseline. But we know all the logistical constraints and restrictions associated with it. So we need to be using tools that are very relevant, that are validated, actually, to be able to pick up and say, yes, this is what I have found, and this is something, that can be used to follow up. So when we looked at that, yes, open field autorefraction is probably a tool that we can look at, sort of using it in school eye health programs, because it takes care of the accommodation processes as well, like, in an open setup where it simulates like how you do your retinoscopy. So accommodation is definitely the key factor, but some of the older, the last decade saw all the myopia control strategies where they were all pertinent to accommodation, lag, and things like that. But the current world is now moving towards another thing of peripheral hyperopic defocus and things. But what really comes out from all our experience is definitely this near visual behavior. And Anu was mentioning about this gender, and you also was talking about it. So from this study where we evaluated 15,000 children, we didn't find any difference between gender in terms of spherical equivalent refraction, but boys did have longer axial lengths. And urban location, where the near visual behaviors are pretty much different, had stronger or larger prevalences of myopia. So we also, on binocular vision anomalies, based on my doctoral research work, we found a large percentage of convergence insufficiency and accommodative infacility are found among school children specifically after 11 years of age. So this 11 seems to be a very magic number. So anybody after 11, I think, and 13 to 16 is somewhere where we need to be focusing all our strategic planning, implementation, and everything in terms of picking up both myopia and binocular vision. That's what I would like to say.
Thank you, Rizwana. Shankar, this is a bombardment of lot of scientific talk for you, I think. So from Hoya's point of view, Hoya is relatively a new entrant, I would say, in terms of Indian myopia, the landscape of myopia as far as India is concerned. So what do you think are your responsibilities towards this huge, myopia boom that we are going to see or already seeing according to the data that is being, discussed today?
Yeah, Hoya, not only Hoya, but the corporate companies together has to fight against myopia, and the now the research and the development should spend more time and energy in bringing in a new product, not only in the optical industry, but also in other industries which are dealing with the myopia management.
Anti-myopia.
And yeah, though Hoya is new to India, but Hoya has been working in the background for quite some time in bringing in a new product or a new methodology of managing myopia. They have been doing this study for quite some time. And we have entered into India maybe 3 months back with a product which is a non-invasive way of managing the myopia for the children. And the results are also been very encouraging for us when we get the feedback from other countries. The results are very encouraging, and hope so that it will also be working in the Indian eyes, and we'll get the same results as that of the other countries. See, myopia management is one thing which is not been spoken today. It's been spoken for quite some time, but the prevalence of myopia after the COVID has become more and more. More and more being a talking point like a COVID. And now everybody knows what is pandemic. So when you go and say myopia is going to be the next pandemic, everybody will realize that there is a dangerous risk which is involved in myopia. So I would say that corporate companies has to bring in more and more newer, innovative methods of controlling the myopic progression. To be proud, Hoya has taken the first step forward in bringing in a new product in myopia progression control. Hopefully, I think many corporate companies will also come in and put their energy and resources in the research and development, and have a vision to thinking about more than 10, 15 years of futuristic thinking in myopia management, because after the COVID, the complete thought process of these R&Ds as well as the optometrists and ophthalmologists thinking should be different, because before COVID and after COVID is what we are segregating each and every industry. So myopia also, as Rizwana was saying, it should be differentiated before BC as well as AD kind of a thing, before COVID and after COVID. So when we attended few of the LVPI's corporate presentations and all this stuff, we were able to see there are people who are talking about the world's population, 50% is going to be myopic in the year 2015, 50 or so. But most of them, when we discuss internally, we all feel that it will not be 2050, it will be much earlier than that because of the COVID. So,
you're right.
so these things has to be spoken about in various councils and various forums. Thereby, the corporate companies, with the help of the optometrists and the researchers, needs to provide the complete awareness, start giving more awareness to the parents as well as the kids, and then bring them onto an table where we discuss about myopia whichever forums we are in. So thereby, I think this can be tackled over a period of time with the kind of research which is going on, because I would see Rizwana doing some research, Anuradha doing research. So there are talented optometrists who are already into myopic research. So I think it shouldn't be a problem over a period of time getting any new products or getting any new way of myopia management in India.
Thank you, Shankar. Anuradha, back to you. Just picking from what Shankar was saying in terms of role of optometrists in this epidemic or pandemic, whatever we want to call this. See, optometrists, I know that when it comes to screening, we as a team, including you, Rizwana, and the others as Myopia Task Force, we always been emphasizing on comprehensive eye exam and not just looking at visual acuity, refraction, and then sending the person off. I think that is where optometrists performing screenings is such an important aspect, because we look at all the aspects when a person is screened and then refer it appropriately. So looking at that role of optometrists, and on the other hand, looking at myopia, especially with India, where it's so diverse, so many different languages, so many different landscapes and all of that. Having the power to do a comprehensive eye exam and having the power to communicate to parents. How do you feel that we need to play a role in terms of, getting the message across to parents in terms of myopia, awareness of myopia, importance of eye exam, importance of a comprehensive eye exam? So that role of an optometrist, what do you think, should be done in that direction?
Thank you, Lakshmi. I think that's a very, very important question that you've raised. When I did my doctorate work, the awareness is always an issue when it comes to you are knowledgeable, you have a very good team, you have infrastructure. When you ask money, people are ready to give, like these people here. So everything is there. Okay, but of course the infrastructure, the technological support, the corporates and the schools of optometry working together, from the service providers side, everything is there. But from the perspective of the beneficiaries, when everything is available, what is it that is stopping them from making use of the service?
Yeah,
that connect, it's always been a big question mark and a gap. When I did my doctorate work, to understand what stops a beneficiary from being a compliant user or from availing the service, you would be surprised that there are some 100-odd reasons for not wearing a spectacle alone. Okay, and it was very surprising to us. For just a simple thing like wearing spectacle, there could be 100 reasons for not doing so. But we broadly I have a classification as to how all these barriers could be tackled. That's when we decided we should have those interventions that should work on the improving the appearance or the cosmesis. So we just had some interventions like frame and fit related interventions, and then we said motivating the children or role modeling these children, and then information to the parents. All these things we broadly classified under education and motivation. The last one is professionalism in the screening process. How you conduct the screening, the professional aspects of the screening. You won't believe all these three aspects contributed to the improvement in the complaints that I told you. Why I thought, this is very important. This professionalism aspect and the education and motivation answers your questions, the two aspect of your question. The first part is what is stopping the beneficiary from using it. So that is where the education and motivation links. The third thing is how you conduct the screening. Now that is where the professionalism is linked. There is a study which says that giving a free spectacle, giving 2 pairs of free spectacles along with the professional optometric screening, it improved the complaints to a significant extent than a control group. This intervention based on professional optometric screening. So even in my doctorate work, I said the conduct of the screening is very, very crucial. That's where we had to implement strategies like giving the report on time, giving the spectacles on time. So from our side, all this was needed. But what is needed from their side? What would motivate the children? What would motivate the parents? There used to be some focus group discussions with the children and parents. I still remember one 8th standard grade boy, he was telling, you people, you come. I said, we give a lot of information to you. We give you information about how to wear spectacle, how to take care of it, why you should be wearing it. He said, Miss, they call us Miss. Whoever is coming as elderly, they are Miss. Okay, so they said, Miss, you come and talk, but it is so boring. I don't. I am feeling like sleeping. I don't even want to listen. At that too, you will come and give these talks and all at the end of the day, and I want to go home. You are coming and talking about all this. I don't want to listen. I am feeling like sleeping. Like that is the time. I was like really shocked. Really, like all these messages that you go give to these schools. They are not ready to listen to you unless you make it very, very interesting. Okay. So this boy, he said, make it interesting. Make it like a game. So from that time onwards, I have told all my team members, talking is whether you know the procedure, optometry procedure, counseling or not, you should know to talk well, and you should know to do the drama effect to give this awareness to the children. That is
at their level, basically.
Yes, that is very, very, very crucial. That is where the acceptance comes. So otherwise, no, moment we enter into a school, the first response that we used to get is on the tongue. That means like they have come again. Oh my God, like that. Okay. But what
That is
we
so
do,
similar to optometry students, I'm sure.
exactly. So we changed our strategies. No, we changed our strategies predominantly. No, we used to make everything interesting. No, we used to conduct some small science experiments. No, we used to give periscopes designing and all to the children. No, we will go sit with them, teach them so that they can hide behind the desk and see what is above. So when there is fun learning, and then we give them some message, or we used to show them, we used to take a fundus camera and show them what we look inside your eye. See, this is how it is. So no, it has to be made interesting. Once you make it interesting, they will listen to you. So whatever be the awareness sessions that we are targeting, it should be interesting. And about the video that we had for the myopia awareness by the task force, everybody praised it. Whomever I have shared it with, everybody said it's a very wonderful, very professionally made one, and everybody appreciated the video, and the message was very crisp, and I'm sure it reached everybody whom it is intended to reach. And the parents, again, they, of course, they didn't want us to dance and tell them stories and all, but still they also want the messages crisp. Most of the time this information doesn't reach the parents. We are all talking about the impact of myopia and what can happen when the myopia progresses, but are we making sure in our school eye health programs that these information are passed on to the parents? That is one thing that I would highlight to every optometry school who is involved in the school eye health programs. Often our report ends with the school HM or the school principal, headmaster or headmistress, and then it never reaches the parents. So what is it that we are going to do when we want this to work? It should actually go reach the parents who are going to take care of their children, is it not? So that is a very, very crucial step. Yes, awareness is happening in a bigger measure, in a broader measure, everywhere awareness is happening. When it is going to the children, one thing that we should highlight is it should be interesting, and it should be made like a fun learning to the child also, so that he enjoys, he internalizes and retains this information. That is very, very important. And a lot of times we arrange for competitions to the children as like a myopia awareness session, outdoor activities in the form of games. All this will help them remember. At least they'll remember, oh, Kannadi Kudukonu. Those who came to give spectacles only arrange this. They'll somehow remember and connect these things. Parents, important to reach out to them. The moment you say it is important for your child, they are always ready to listen. But it is our professional duty to reach out to the parents and keep them informed about the these awareness and the information that we want to convey personally to them. At least make a phone call them up, and then tell them this information, that your child is having myopia, that your child needs an annual eye examination. Most of the time, the annual eye examination, once you give a spectacle to them, they think that this is the final one. For life, they can use the same spectacle. Still, there are people who are like that. So unless you talk to the parents in person or through the phone, this is not going to be working. And the very reason that we are going and performing an annual eye examination, like with Zeiss, we are working on for vision on cost, for a cost, everything we are targeting as an annual eye examination. So our presence for another year itself is an awareness. So that we are going every year, that itself is an awareness. The schools take us seriously, they respect you, and then they ensure that the information is conveyed to the parents. The parents also believe you there. So that itself is an awareness. So, and I'm really happy that we could do an annual eye examination for the same set of schools whenever possible. So that could be another way of raising the awareness. And all this works beautifully when it is in the rural regions, when you make it very lively and when you reach out to the parents, and you make it annual, because the need is huge there also. So these three things are what I wanted to emphasize.
Iswana, coming to you, now you're in a different position from an institution into,
a corporate.
retail, and if I can say retail. So there it is very different when you speak to parents of children who have myopia, right? So what do you think are the necessary tools? Like, I'll just give you a small example. If you detect a refractive error as myopia and tell them, this is myopia, it would progress. These are the interventions you can do, which are available for you, and all of that. Sometimes they just say, it's just myopia, right? Give me the glasses and, I'm done, kind of a thing, even if they are, very well educated, because they feel that the single vision spectacle is a solution, is the only solution, because it's like, my kid can't see, you give me glasses, I can see, that's it, so what else is required? So as an optometrist, what do you think is very important in terms of conveying the importance of myopia and the ill effects and all of that in terms of communication tools? What do you think can be developed? What's the scope in that area as far as optometrists are concerned? Not only optometrists, maybe even like myopia task force or whatever we're doing.
Right. Yeah. So I think all the panelists so far brought out a lot of important points, especially with respect to what you just asked. Ms. Shankaraman, especially, he brought out the role of corporates, and so I'm currently in a retail practice where the situation is a bit different. Like as you said, it's not. But we are in a very good position, because the role of what I understood after I came over here is that the role of corporates and retail is really, really crucial. The role of private practitioners is really, really crucial in handling, issues like this myopia and engaging the stakeholders, because most often we are the first point of contact for the parents, or any or the consumer or the customer, because they come over for be products or brands or whatever we have to leverage the power that we have and use technology, because we are in an Insta world. So answering your question, especially what we do in terms of bringing in awareness, is that we have a creative team that works towards creating a lot of awareness materials that then goes out to our social media platforms, and then talks about what is myopia, what are the complications and risk factors for myopia, and also the use of comprehensive eye examination, like putting that into real practice. We called it comprehensive eye test here. So beginning from your history taking until fundus evaluation. So when we take the consumer through this entire process, our client, what we use then is this myopia, the fundus image, and also we talk about the complications of myopia and high myopia later onto the structure that is really looking very healthy at the moment. So then we talk about, if required, there are these myopia projection algorithms, the control strategies that are there already available, the Brainhold and Vision, like the platforms that we have. But we generally talk about eye health and myopia as a very important piece in terms of controlling myopia being very important to maintain good eye health and to avoid vision threatening complications in the long run. So when you pitch that, especially to the parent or the child, now maybe spectacles, maybe like looking stylish, but then later we are talking about this half a diopter jump and what it could lead. The second thing is changing the mindset of all the practitioners, especially that single vision is no longer a myopia management strategy. And then you need to really you need to deploy whatever myopia management strategy that is there at the moment, the best practice, because now that we have lots of control strategies in place, optical, if you're in a hospital-based setup, co-managing with pharmacological, and of course, orthokeratology or forte. And so I think what we should do at the moment is definitely leverage. We are, of course, with the handling the Gen Z and the millennials. I think what we should really work towards is leveraging the power of technology in terms of talking to them in their language, because region and culture, so much difference is what you can really communicate. In fact, we tweak the language for different regions, different sectors and age groups. So be very relevant to the society, the community that you talk to them in their language, and also use the power of corporate also to be able to reach out to your stakeholders. And then you can, with your awareness, I'm sure, because when it comes to India especially, we are really in a very good position, because all the efforts that we really put in now can can save us from the epidemic that the other parts of Asia is really seeing.
Yeah.
So I think we are coming together at the right time, and we can really do great things.
Yeah, it's like telling catch them young. Maybe we caught it earlier on, somebody recently said that history will not forgive us if we miss this opportunity. And it's really true. As optometrists, if we miss this opportunity, future generations will never forgive us for not having caught on to this and developed on this.
Yeah, ma'am, and to quickly add, because we have Dr. Anu, who's a education head in a college, to actually implement even myopia management as a core subject, because the undergrad curriculum, myopia management should actually become a part of the curriculum, and the training should start from there. Yeah.
Yeah. And I'll add on to that, Anu, IACL is already thinking of something like that in terms of adding a small module in terms of teaching curriculum for myopia management.
So I'm already giving a revision for that.
Okay. Coming to you, Joe, OCI and, your corporate company, CSR, and all of us are involved in this massive project for Vision for a Cause, where we're looking at 25 optometric colleges adopting government schools, creating awareness, catching refractive errors much earlier on, providing a comprehensive eye exam. Not only that, but also following up and looking at compliance of spectacles. What do you feel, would be, the benefits of something like such a huge one, where we are not just looking at, corporate, a visibility or an association or an organization visibility, but we're looking at something in terms of eye health, providing eye health to so many people. So what do you think is going to be the impact of something like this, where everybody is actually benefiting?
Thank you for that question, Lakshmi. I think, of course, first, I hope many thousands of school children will benefit from comprehensive eye care, and especially from frequently provided comprehensive eye care. So not only once and then never again, but really annual, or at least every 2 years. Let me explain it a little bit for Zeiss as a corporation. Why are we doing this? Why are we being engaged in such a massive program? It's not for corporate visibility, believe me. It's also not only for corporate social responsibility or things like that. I really believe to find better ways to manage myopia. We need to understand it much better. We still do not know perfect ways to manage or even control it. We don't know how to stop it. We have different kinds of specific eye class lenses and other treatment options. Definitely, we still are in the very beginning to understand, especially progressive myopia full. And for us to understand it is very important to be in the field, to see myopia in the field.
Yeah.
And for us, Vision for a Cause is a huge learning opportunity, and it's a very unique opportunity to link with other organizations, to collaborate. This problem is much too big to say, okay, Hoya or Zeiss or Optometry Council or Lead School of Optometry will solve it. We need all hands aboard. And Vision for a Cause is a fantastic opportunity, really, to bring the relevant partners together, optometry colleges, to NGOs, local partners. And then we will see, and this is also important for us, we will see the next generation of optometrists being much better educated on myopia. And I like that what Anuradha said, and I know some of your tools to make education and awareness raising fun. Yeah, I always think if screening or eye test at school is a medical experience, and you feel like, oh, now I need to go also to the eye doctor, that would be counterproductive. Let's make it more fun. Yeah, let's make it interesting and educational and entertaining experience. So the kids start loving to see an optometrist frequently. And also maybe be excited to talk their parents into it. And this will also help on the side of the teachers. We need the teachers in the school boards. We need the authorities. We need backup from public health institutions. And so you see, Vision for Course, I really love this very, very much. And we are very eager to give it a full speed start. This is combining all, I would say, is important. Access to the children, access to teachers, very professional support and involvement of optometry colleges, of the next generation of optometrists, a little bit corporate support, of course, a little bit money raising too, no doubt. And we will see also how screening protocols work. How can we combine mass screening with comprehensive eye exam? It is not you can do it very quickly. In bad quality, no doubt. That's unacceptable. We all agree, I think. But on the other hand, we have just to screen methods. So how do we find a good balance? How do we ensure quality? How do we ensure compliance among the school children, the teachers, the parents, and so on? And this will be a massive learning experience for every one of us. And then I really hope we share the results of the experience with everyone, with Hoya, with Essilor, with Vision India Institute, right. I don't care who, because if everyone is making the same mistake for his or her own, this is waste of time and money. And we don't have time. Myopia is pandemic and we don't have time to waste. So I'm really very much looking forward to get it started.
I think you brought a very good point, Joe, in terms of, the optometry colleges and students who are going to be part of this. They're going to learn so much more and become better practitioners tomorrow. That is something, such a, what I would say, untangible kind of a benefit that comes along with the project. And especially when you're following the same protocol all over, I think that is really fantastic. So thanks.
You get fantastic data also to see differences in prevalence, in progression, etc. Yeah. Is there a connection between school type and education program or curriculum at schools and prevalence of myopia? We have first signals that there is a connection. To prove that would really help also to consult with schools and they make little changes to your curriculum. You really could help to prevent a lot of myopia.
Shankar, as Anuradha was saying earlier, even in private schools, the awareness, although we think that, everybody would have educated parents and so on, the awareness is still low. In fact, last week, Paula and myself had a session with Delhi Public School here in Bangalore, which has many branches all over the country. So we thought if we get our foot inside one of the branches, then we can try and expand to increase the awareness. We gave an awareness talk for 5th to 8th standard. And I was amazed at the questions the kids were asking, totally amazed. It's like when, we were telling that there is more risk if the parents wear spectacles that the kid will. So it's like, my parents wear. So do you think I need to go for an eye exam? So, that kind of a spark where the kid pushes the parent saying that, I need to have an eye exam because kids, like as a sponge, they kind of absorb whatever you're trying to say. So in that aspect, as Hoya, do you have any plans in terms of reaching out to such private schools and increasing awareness, or you think that, you're looking at partners who could do that in some way? I mean, what are your thoughts in that direction?
Yeah, in fact, it's a very initial stages where we have stepped into the myopia management, and because we normally deal the single. I mean, as Rizwana was saying, we have to now look at single vision as a lens for vision correction, and we'll have to look at the DIMS technology, other technology as the myopia management. So we have to segregate these two because that's where we also lead the path towards, because when you combine everything together and your focus will also be diluted. So you have to focus on myopia management and keep those myopia management tools which are all available with you and you have to walk along with that myopia management tool, and then you have many things to follow. Because as Rizwan was saying, single vision is now everybody start using it, but in some of the forums we see, if you give a single vision, it is going to worsen your case. So we need to first filter out what is the right way of myopia management, like where other panelists were saying. And yes, though it's very initial stages for us, we are also looking into creating more awareness programs with joining hands with the associations and people like OCI and other associations also. Though we are in a very primitive stage and we are just working on it, but we are looking at the schools as one of the major places where we need to do an awareness campaign. And as you said, the children pushing the parents will be more ideal rather than parents talking to the parents now. And another thing is now, because of the COVID, the restrictions of schools and the public, the people coming into the school is restricted. So we are also keeping our fingers crossed, being the next Omicron and other things are coming, and we don't know what's going to happen in the near future. So we are just waiting to hear from these educational departments as to what their plans are. So if it is getting delayed, then we may have to look into another source of awareness creation for myopia. It should not be a kind of a threat. We need to talk to them. We need to talk to them kind of the children should come and involve themselves, and they should expose that they are not able to see properly. So that is one thing. And we can also look into the screening in the beginning of the school reopening days, for a few days, and then like how these people pay the fees quarterly, half-yearly, and an annual structure. Along with that, also we can have the eye screening, which has been done quarterly, half-yearly, and annually also. And I heard that there are some schools in China where if you are supposed to wear a spectacle lens, and if you don't wear it, then they mark you absent. So the attendance is also one of the. So these are all things which are there.
Do that here. Tomorrow you'll have a strike outside the school. Anuradha, what do you think? It won't work here.
So these are all the things which are happening outside the country. So there are many things where the awareness to the children are being focused on, because the child at the age of around 6-7 years will not understand what future problems they are going to get. But when they reach 13-14, when they are mingling with the adolescent team, they will then understand. But it will be too late for us to correct that particular point of time. So how we are going to talk to them and how we are going to approach these children below certain ages, below 10 years or 8 years, is more crucial rather than talking myopia as a whole, because they don't understand. Most of the parents are not understanding what is myopia. Most of the educated people are not unaware of myopia as of now. So we don't expect the kids to be more brilliant than the adults. So we have to reach out to them in a proper way, telling them what is right, what is wrong, and how to talk to the parents, or how to inform the teachers that they are having a vision problem. So vision problem, they should not be afraid that any vision problem will lead to myopia. So there are many things which are there. So we have to subtly tell them, and we have to also help the private schools to do the screenings on maybe a half-yearly basis or an annual basis, and then we can join hands with other associations as well. Yeah.
Thank you, Shankar. So I was just thinking, like when Shankar was saying, it's very important to kind of catch them at a younger age so that you detect myopia earlier and you do some kind of intervention so that it doesn't progress. That is as important as also getting across the information to the elderly kids, where they understand what is myopia and myopia progression. Both, so I guess it has to be a multi-pronged approach when you look at a school of and for different ages as well. There's an interesting question from Facebook. Mr. Gajendra has asked, can you please highlight a few points of myopia association with general health? Like, does myopia progression affect general health of individuals? Anuradha, you want to take that first in terms of general health?
Myopia affecting the general health, I'm not sure about what exactly the question is, but there is now an association between the sleep, the sleep timing and then the myopia. No, I'm just assuming that he's talking about such associations, definitely. And there are evidences that say that lesser the amount of sleeping, then the more the progression of myopia. So there are evidences like that. I'm assuming that the question is like that.
Yes.
Otherwise, the other part of the question is on gender inequality and political and social determinant. How is myopia affecting the community? Political and so gender inequality, and we discussed about about how the female is having more prevalence nowadays, and we talked about it. Everywhere we have seen that access to eye care services, when it comes to the access, there is always a concept of gender inequality which is being discussed, whether it is no eye care services for the children, the female and male differences, because the prioritization that are still given in a patriarchal society, it is still more towards the boys. Boys get to get access to the eye care services better. Or like even in cataract surgical cases, the access to cataract surgery, we have seen that there is a bias in the availing of services always. So in terms of gender inequality, I always have a feeling that school eye screening can compensate for this imbalance, and it is actually reaching out to as many girls as much as boys that we are doing. So I had a presentation during the 2019 AO where we had evidence saying that we had presented evidence saying that how we could improve the complaints, how we can bring out many of the visually impaired girls through the school eye screening program into those away from the visual impairment. I feel that these such programs have to be continued irrespective of the other difficulties that we are facing due to the pandemic and everything. And the other part of it, the political and social determinant, how is myopia affecting the community as such? We see here that most of the time, the whatever expenses that a person with myopia has to do in our community, it is coming as an out-of-pocket expense in this country.
Yeah,
and
absolutely.
that is a very, very major point. And we in our place, like in our country, spectacles are not even under the medical devices category, and with more tax, and the burden of myopia on an individual is very, very high. Approximately, I would say on an average, an individual would be spending around 5,000 to 6,000 rupees annually for a spectacle, for a single vision spectacle. And then imagine, like, including the cost of consultation, including the travel, and including the other diagnostic services that he might be needing, or if he's an anisometrop, you need at least definitely a contact lens correction. So all these things put together, it could be on an average like this, but for children, it is going to be even more. So from the point of social determinant, the myopia being a social determinant, it is going to be a huge burden on an individual and thereby the community. That's what I feel. And it's a very important point. See, now we are seeing an increase in number. We are saying that this 50% of the global population becoming myopic. I am sure there is going to be a decade in advancement with the numbers reaching 50% definitely. So all this burden is going to be on every individual in our country where it is not covered by insurances, right? So it's a huge burden. From the point of social perspective, I feel that the government can bring about systems wherein some exemptions can be given, or insurance coverages, especially for those with progression of myopia or who needs high myopia and its management. At least in such cases, we have to think about these coverage systems. And probably the political and social determinants, these things have to be combined. The burden is huge. Economic burden is what is the predominant reason for many other determinants, including the advocacies and the political advocacies and the other things, that the changes that we want to bring about.
Actually,
maybe I answered it in part. Yeah.
Also, Anuradha, we also, on a different level, we were also discussing that sometimes what the government provides reaches in pockets. It's not evenly distributed. So like one school, government might provide a lot of resources, and then there are some sectors where the schools, nothing is provided at all. same government schools in different districts, it kind of happens. So maybe evening them out also would help. And the other thing in terms of gender equality, even now, spectacles are looked at as a taboo by especially female children. Because recently, just 2 weeks ago, when Achyuta did one screening, not Achyuta, in Mysore, when we did a screening, the person came back, the optometrist came back and said there were 3 kids, female kids around 13 to 14 years age, who refused to even select the spectacle frame, saying, I'm not going to wear it, so why should I select? I don't want to wear glasses. So there was this whole 1 hour of coaxing by the optometrist to explain the issue that they have, what improvement in vision they would have, and all of that. And then after that, they didn't even want to look at the frames. Even if you say it is looking good or whatever it is, they just didn't want to look at it. So, there's a whole range of things that comes along, socioeconomic, that comes along in terms of even just a simple thing that people might say as spectacles.
Ma'am, I'll just quickly add, especially, with my recent involvement with IAPB's advocacy work that I'm continuing to be doing, and all the World Sight Day efforts that we took, right? One of the key piece that we used is this Lancet's, the recent report, the Global Commission's report, yeah? I mean, I put the link that maybe Gajendra can take a look at, because the commission, the executive summary of this commission very clearly states that eye health means it's maximized vision, ocular health, and functional ability. Thereby, it contributes to the overall health of an individual, social inclusion, and quality of life. And this paper beautifully brings out all the issues with being gender equity, because especially women, rural population, ethnic minority groups are the ones that are more likely to have vision impairment. And what tops the list next to cataract? Uncorrected refractive errors. And of course, myopia is going to be occupying that space. And I think we need to be using these key pieces of information also towards advocacy, towards promoting the need for optometrists, other important stakeholders to come together. But definitely, yes, eye health is very, very crucial for general health. Even in the older age group, we know that increased falls, increased mortality rates have been reported with visual impairment, and myopia is no exception, I would say.
Yeah. So a couple of questions that came by. I think it's we've almost gone more than 5 minutes past the hour. So thanks. Thanks. I think this topic is so engrossing that I think we can just go on. And did we ever think that when we studied that refractive error would become so complicated? That is what I just think, Joe, did you ever think that, one day refractive error is going to become so complicated? I think in the days when we used to study, we used to think, oh, glaucoma, oh, this, diabetic retinopathy, oh, arterial occlusion, and all of that. And refractive error was just refractive error. That's what it used to be. But now it's like nowhere close to what we thought it was. What we thought was a simple refractive error has become so complicated and so multifactorial, I would say. So thanks to everybody for your time, and it's been good participation even on Facebook in terms of the questions that came by. And Paula, if you can also come on video, that will be really nice to have a nice screenshot in the end with everybody. And and you being behind the screens do maximum work. We just do only the talking. So thanks to you, Paula, for putting the entire show together. And thanks to you, Joe, for even the time difference and all of that, having come to this panel discussion. And Shankar, I know you travel a lot as well. So despite that, having agreed, and of course the two stalwarts who are sitting here, Rizwana and Anuradha. Professors, thank you.
Thank you.
Thanks a lot to all of you.
Ma'am, I'll quickly pass my acknowledgements to the myopia team. I mean, Ms. Aparna and Dr. Vishwa, because their role in terms of getting all this data was very crucial. So I send my acknowledgements to them.
Okay, thank you. Thanks,
thank you so much, everybody. It was a wonderful session. Yeah, thank you.
Have a great weekend.
Thank you.
Thank you.
Bye.
Thank you. Bye-bye.
Bye.